Prescriptions for off-label drug use are a common practice in medicine, but some experts caution more care needs to be taken since adverse side effects are more common with off-label prescription drugs, and doctors are sometimes not even aware they are prescribing for off-label use. Here with the story is WSJ Health reporter Sumathi Reddy. Sumathi, great to see you.
Nice to see you.
First of all, explain what exactly is meant by off-label.
So the Food and Drug Administration, when they approve a drug, they approve it for a specific indication or diagnosis, condition. And so if it's used for anything else or in a different dose even, then it's considered off-label.
And it is a widely accepted practice, correct? Even though drug companies are not allowed to market for off-label uses. Is that right?
Yeah, I mean, as many as 20% of prescriptions are for off-label uses, so very widely practiced.
And which types of drugs are more commonly prescribed for off-label use?
So antidepressants, antipsychotics, anti-seizure drugs, as well as drugs for like certain populations, like in pediatrics it's often used, cancer patients, those kinds of things where it's hard to do clinical trials with those kind of patients.
It's interesting, and there was a survey of doctors recently that showed in many cases doctors were not even aware they were prescribing for off-label.
Yeah, it's amazing. Right? I talked to an orthopedic doctor, surgeon, and he just said, honestly, I have no idea when I prescribe a medication, whether it's for an on or off-label use, and it doesn't really matter. It's based on my clinical experience.
Right, which is interesting because other studies also show that there's a higher likelihood for adverse side effects, correct?
Yeah, so that was a recent study that looked at, in Canada, that was able to look at it and found that there was 40 to 50% greater increase of adverse side effects when drugs were being used off-label.
And what, in general, are these side effects?
So gastrointestinal is a common one, nervous system and respiratory system. The study did not look at the severity of the things. I'm not sure if we're just talking about like a stomach ache or something where you're actually going to the hospital because it's that severe.
But it's enough to be concerning, and it's enough to sort of want to have maybe a little bit of reform in the off-label use. So what are people calling for? What are some doctors calling for?
So there's a project being done at Harvard where there's a researcher who wants to kind of come up with like an electronic health record that will make sure that the indication and the drug are both, being collected
on the label, because when you get a prescription, it doesn't say what this drug is supposed to be treating.
Yeah, no, which is very bizarre. Yeah, when your doctor writes out that prescription, like no one's keeping track of what it's being used for. That's why we don't really know how much on or off-label use is.
So how likely is this to gain steam, this movement?
I mean, this is a 3-year project, so yeah, it's hard to know whether it's going to go
anywhere or not.
Yeah.
All right, well, it's good to know why you are being prescribed a drug, right? As a patient, very good to know. Sumathi Reddy, thank you so much for that.
Thanks.